Waldenström's macroglobulinemia is an indolent disease. Patients usually can be treated very well with many different approaches, but some of them are toxic, and despite this, some patients require many different therapies. At this moment, the standard of care is the use of combinations with Rituximab plus other drugs, for instance, cyclophosphamide or Rituximab or bendamustine. But these drugs usually provide some relevant secondary effects. At this moment, the new class of drugs, such as BTK inhibitors, are a new promise for these patients, and this is what I am going to reflect in my session. One of the most important advances that's going to be presented here at the IHA meeting is the use of Ibrutinib in combination with Rituximab that has been compared with the standard therapy that would be Rituximab alone. And which is very relevant is a high difference between patients receiving Ibrutinib and those receiving placebo in terms of progression-free survival, which is has a hazard rate over 3 favorable for patients who receive Ibrutinib. In addition, the secondary effects are not very relevant with Ibrutinib. We have the most important problem is hypertension or atrial fibrillation, which are present in around 10% of the patients, but are very manageable. And in contrast, the use of Ibrutinib provides a reduction in the infusion-related events when the patient receives Rituximab, which is virtually inexistent when the patients receive Ibrutinib. So I think that are exciting results, and they are already very mature, and I think that they will be a new standard for the therapy of patients with Waldenström's macroglobulinemia.